So Pedro's had radiation treatment, and now he's got some swelling and lots of pain in his hands. Plus he's got triggering of the little finger and the middle finger, but more severe in the little finger. He has a very old scar. So this is from the 60s, the late 60s. He was shot in the wrist. So immediately you can tell that the scar is adherent, and this is going to have issues with the radial nerve. So I'm just doing a pendulum assessment just to see if I'm right. So if you can turn your hand over. So I expect over the A1 pulley for this pendulum to be going forwards and backwards. And you can see there is a Dupuytren's nodule there. So your middle finger's triggering, hey Pedro?
Yeah, not as much as the little one.
Okay, so let's look. So there we go. So that's picking up the triggering in the middle finger. Index finger is still. Ring finger, a little bit of movement, but more circular, so more neural tension. But in the little finger, it's picking up significant issues with that triggering. If we go to the carpal tunnel, the carpal tunnel is highlighted. And then I was looking at the CMC joint. So because it's actually spinning in circles, I know that there is radial nerve irritation. So if we just turn your hand like that. So now, if we look where the scar is, there is the nerve branch of the radial sensory nerve, the lateral cutaneous branch of the radial nerve. And if we go around the scar, it's more irritated there where it's much more adherent. And then going up to the radial tunnel, if we look at the cubital tunnel, no problem. And the region of Lacertus, no problem. So certainly radial nerve on that side. Let's look at your other hand, Pedro. So there's no triggering in these fingers, and that's demonstrated nicely with the pendulum. Let's check over here. So no radial nerve irritation here. So that just shows you we've got it on the other side of the scar. Turn your hand over, please. Yes, I just want to check the... So there is some radial nerve irritation over radial tunnel. Okay, so there is some irritation at the first dorsal compartment. Let's check your elbow on the inside. Turn your palm up. Okay. Ulnar nerve is calm. But not so calm at the cubital, at Guyans, and so certainly irritated. So the feeling that you've got of sausage fingers is coming from the median nerve, even though your Phelan's test was negative. So testing the carpal tunnel is negative, but it's definitely sensitive. So I'm just using the Spectrochrome laser over all the joints because they're so painful and swollen. And then we are going to target the scar because this nerve is getting trapped under the scar. Okay, turn your hand over for me. I'm going over the carpal tunnel and the trigger finger. So I'm able to treat multiple problems here. I'm going along the median nerve, even though it wasn't flaring up. Okay. And then what we'll do is we'll assess it using the pendulum. All right, so just green light, and now we'll have a look So carpal tunnel still. Trigger finger is still. Let's go to the nerve. Turn your hand over for me. So we're starting here. A little bit of movement, but tiny. Let's go up to the radial tunnel. Looking good. How does it feel? Does it feel any different?
Not yet.
Okay, let's look at that. Let's start treating the other hand. Okay, turn your hand over for me. That's it. Okay, so that's all we need to do is literally just shine that light. Okay, let's have a look. Starting at the radial tunnel. Looking good. Okay, come over here. Turn your hand over for me. Very good. Sorry, knocked it. Super. Okay, so we've just applied some kinesio tape after the light. Can you just bend your finger? Let's see if it's triggering.
No, not strong enough for triggering.
Okay, and open and close.
I could force him to trigger.
Just try close your hand lightly, not forcefully. And open. Voila, no triggering.
No triggering.
Does the hand feel better now?
Yeah.
Okay. All right, so what we've done is we have lengthened the radial nerve and the dorsal sensory branch and the lateral cutaneous nerve. This is simply for our trigger finger. This is for our carpal tunnel. And we've done the same on this hand. Okay, so now open and close your hands for me. How do they feel?
The right one is better. Yeah, they are all right. They are better.
They're better. Okay, more easier to move. Turn your hands over. And what we've observed is already there's less swelling.
Will the wrist pain not come back quick?
Hopefully not. It should last 3 days.
3 days.
Yeah. But I'm going to see you before the 3 days. Okay, so you've just got to endure the tape for me until Thursday. So now we're just doing one last run over with the green light. Literally before our eyes, the swelling has gone down prior to taping. Turn your hand over. Wrinkles are coming back, which is what we want. Okay, turn over for me. So we're just doing a once over now. So the kinesio tape will be there until our next session in 2 days. I don't leave the sessions long apart, rather treat close together and then discharge sooner. So we have Pedro a few days later. So just before treatment, we've taken off all the kinesio tape. And I'm just doing the pendulum assessment. Flicker of movement. This is the one that had the neural tension. There's none. And this is the triggering getting better. and it is much better. Let's go back here. He's on blood thinners, so we had a bit of blood from the skin. This is much better now, so we don't need to go back to kinesio tape anymore. So we've resolved that problem. It's actually much, much better. And then let's turn over this hand.
Turn over the hand.
Turn over for me.
Turn over.
Pedro's so relaxed, he's sleeping. Okay, so we're making progress. This is our third session. So now we're going to just do the treatment.